Allow me to open up your mind a little bit. If diabetes was all about the sugars that are present in blood, and then medication for diabetes will be perfect therapy. But the question is, why is therapy always focusing on reducing blood sugars and nothing about reducing sugars in the fat cells or in the cells already? Because diabetes is not what is in blood, is what is actually in your system, in other cells like the liver cells, like the fat cells, the muscle cells. So drugs constantly send sugar from blood into these cells because they increase sensitivity of insulin to these cells so that you open up these cells and sugar flows from blood into these cells. However, you are already diagnosed with diabetes. What does that tell you? That there's so much sugar in your system entirely, plus blood, not only in blood. But then where are these drugs sending these sugars to? The same system that has sugars? These are questions that we ask every time and people get upset and possibly they pull down this video. But this is the truth. Nobody or no system is telling you how to actually block yourself from bringing in more sugar when you're actually suffering from a sugar problem. No system or therapy is going to help you burn the sugars that are already creating a dump site in your cells, the fat cells to be specific, and the liver cells. So why are we not telling people the truth? Doctors, nutritionists, pharmacists, why are you not telling your clients the truth? That diabetes can only be reversed when you stop bringing in the problem, sugars, and when you burn what you've already stored in the fat cells in form of fat. When people are fasting, they are actually reducing their requirements for insulin. That's how you become sensitive to insulin. Remember, diabetes is insulin resistance. So the opposite of that is sensitive to insulin. And the only reason why you are using medication for diabetes, injecting insulin therapy, or you have high insulin in your system is because you're constantly feeding the problem. You're constantly eating the carbohydrates. Even if it's a fist size of ugali, it is still a carbohydrate. You are actually suffering from a chronic carbohydrate intake condition. A lot of sugars in your system. The blood sugars are just an indicator of what is actually happening in the system. So then why would you constantly feed yourself with sugar when you already have sugars in your body? It's time for you to ask those questions. Okay?